Do you recommend dipping a dental pick in black seed oil to floss to help tame the bad bacteria in the gums?
I mean, a lot of people do oil pulling with coconut oil, and which has antimicrobial properties to it. So if this does have antimicrobial properties, then I see no harm in doing that, and it probably helps to get the pick through there better and even make it maybe a little harder for the plaque to stick on the tooth. So that's what I would say is if it's working, then hey, then it's great.
Great. Jeanette, let's hear from you.
Yeah, black seed oil has been used in Europe quite a bit to help with receding gums or any gum issues, and just by rubbing the oil on the gums. I guess the question is more about how do you get it in between the teeth.
Great. So this is the remedy. Sounds like it has some dental advantages and some from the more holistic approach. And from our perspective as periodontists, we're looking at two aspects. First of all, we want to mechanically remove bacteria. Of course, within 30 seconds, those bacteria will reestablish their biofilm, because that's how bacteria organize on structures in general, but specifically in the mouth. And so that, there are different ways to do that. And second, there is also we call it chemotherapeutic. It's not in the negative sense from cancer treatment, but there are certain substances and certain rinses that can also help and work on that level against certain bacteria. But please remember that our goal in dentistry is not to eliminate bacteria and not to eliminate all the fungi and viruses in the mouth. If we do that, we're going to get parasites, and we're going to get worse. So remember that part of the human body is to have microorganisms. We actually would not be able to thrive. And a quick fun fact is that in the breast milk, there is 40% of the breast milk cannot be digested by a baby. So why is it there? It's there because it's feeding the baby's microbiome. That interrelationship is that significant. So the human body created that feeding mechanism, not just for the baby, 60%, but 40% goes to the microbiome. And here's your proof. So we don't want to get rid of all of the bacteria and all the microorganisms. We just want to make sure that they're balanced and they live in harmony. And if they don't, call a dental professional.